This is GAC Assessment Event 3 Seminar Presentation. Today is May 15, 2020, and we're at UVM Campus Cumbres. My name is Elizabeth Lozano Muñoz, and my ID number is UVM 41998. The topic to be presented today is Leading Medical Advances and the Future. This presentation will cover up question and thesis, definition, improvements in advances in history, including a treatment and intervention approach and a healthcare approach, the healthcare expenditure, the clinical medical advances, including a medical technology approach and its impact on human health. Then I will present the reference list. We will have a 5-minute discussion and wrap up with an overall conclusion. Now, the key question selected to answer during this presentation is, what are some current leading medical advances and what does this mean for the future of humankind? The thesis states, the current leading medical advances, driven by technological developments, are increasing the life expectancy and improving the life quality of humankind. This is because health is a main contributor to a person's happiness and well-being. Now, there's no specific definition to what a medical advances, but according to Oxford's Learner's Dictionary, medical means related to injury or illness and their treatment, and an advance is a progress or a development in a specific or particular area of understanding. So we can say that a medical advance is a progress or development in which injury and illness are aimed to be treated with efficiency. Now, some important advances in history regarding treatments and interventions are vaccines, antibiotics, organ transplants, the introduction of MRI, and the usage of anesthesia. Vaccines are biological substances that pretend to stimulate the production of antibodies against the introduced antigen. This helps the organism to recognize and fight the disease if it is later introduced naturally in the body. Antibiotics are chemical substances that are used against bacterial infections. They help eliminate these harmful organisms from our bodies, keeping it healthy. The organ transplants are surgical procedures in which the organ of a foreign body is removed and later inserted into the body of a suitable host. This usually happens when the host's organ failed or was damaged beforehand. MRI, or also known as the magnetic resonance imaging, is a non-invasive scanning technique that allows organs and other soft tissues to be viewed with the help of a magnetic field and some radio wavelengths that provide detailed images in a radiology scan. Now, a doses of anesthesia, usually administered before a surgical procedure, allows the loss of sensation to become its prime characteristic. Local anesthesia works with a small area of the body, whilst general anesthesia numbs the whole body. The first is not associated with the loss of consciousness, but the second one is. Now, some important advances in history regarding healthcare include the 1939 National Healthcare Act modifications, including the introduction of the National Health Bill by Senator Robert F. Wagner, which stated the right to establish a compulsory health insurance, and also it was later turned down by the AMA, which is the American Medical Association, with the argument that politicians should not be involved in the future in the modification of the American healthcare. Later, in 1945, this same Senator Robert F. Wagner, along with Reed Murray, established another national health bill, and this one stated that healthcare bills should be paid with payroll taxes, and although this caused a lot more commotion and attracted a lot more attention than the previous bill, this was also turned down by the committee. Then in 1965, the Social Security Amendments was a basic supplementary program for people aged 65 or older in order to help them pay with their healthcare bills. Now, in 1991, the Universal Healthcare Act was a national single-payer insurance where eligible citizens could have some comprehensive benefits without the need to pay any deductibles. Then in 1996, HIPAA was established, which is the Health Insurance Portability and Accountability Act. And this established national standards for the protection of patient information, including its use and disclosure of the same information. Then in 2009, HITECH, which is the Health Information Technology for Economy and Clinical Health, established the helpful for the use of electronic technology information. This graph shows a worldwide healthcare expenditure. In 2014, United States held a 17.14% of the total healthcare expenditure as a share of national GDP of this same country. And as you can see from the blue range below, the blue range holds a directly proportional relationship to the amount of healthcare expenditure. The darker the color gets, the higher the healthcare expenses. Now, some current leading medical advances, including medical technology, are the 3D organ printing, improvements of genetics, the usage of virtual reality in medical education, and some bionic prosthetics, and the clinical electronic sensors. Now, 3D organ printing is an advanced technique where biowinks, which use living cells, set the structures that mimic those of a naturally grown organ. There are some simple structures that can be printed, such as skin, teeth, and ears, but there are some others that are too complex to be printed yet. Now, in the improvements of genetics, not only improved scientists' comprehension of the knowledge of genetics, which includes the first publication of the genome sequence, of the human genome sequence, but it also redefined the future, such as with more accuracy, having prenatal tests and tests that detect genetic abnormalities. Then the improvement of the usage of virtual reality in the medical education. This helps to having more realistic models and have more realistic situations in which they could practice with and have an enriched educational experience from. Then the bionic prosthetics not only redefine the future of prosthetics, but they also improve the quality of life of paraplegic and quadriplegic people. This is because these technologies adapted to the brain sequence, electrical sequence, to allow a better mobility of these structures. Then finally, the clinical electronic sensors allowed to perceive with more accuracy the senses in which they are perceiving, such as a blood glucose monitor and electrical thermometers. Finally, the impact of human health is a chain reaction, which was a chain reaction by improving the treatment and telemedicine, by improving these systems. You could say that their coordination within the medical community improves the patient outcome expectations by giving it a more narrow focus on them. Thus, by increasing the patient outcome expectation, you increase the quality, the life expectancy, and improve the life quality of these same patients. Now, this is all by providing a healthier lifestyle, as I said before, by improving these systems and by improving their approach to the patient care. This is my reference list. I used a total of 13 references, and you are welcome to check them if you have further doubts. These are reliable sources, and as you can see from the ORG and the authors and the years that they have. Now we will have a 5-minute follow-up discussion session, and I will present 3 questions in which I would like you to participate. The first one is, do you think these medical advances were somewhat predictable?
I I believe that these advances were not predictable, or at least that people wouldn't think that, for example, the virtual reality you mentioned that is used on medicine. Well, in my case, I didn't even know that, virtual reality was used in medicine. So I think that people who, before couldn't even, like, at any point predict this.
What do you think, Julieta? Do you think these medical advances were somewhat predictable?
I think yes. I mean, in the fact that I don't know, as my classmate mentioned, virtual reality. This was one of the first options that were proposed to not use the amphitheater. How do you say it? The amphitheater. Yes, the fact that they use real organs, or you have to be there in order to. I think it's more close to reality, and you do not cause harm, and so I think that maybe they were a little bit predictable in some level.
Benny, what opinion do you have about the topic? Do you think these medical advances were somewhat predictable?
I do think, from my perspective, that they were a little bit predictable. They are developing now because they were necessary. So I think because of that, yes, it was predictable that the advances would fulfill like the necessities that we have. But I still think that 100 years ago, 50 years ago, this would be the dream on the not a reality that we're stepping on. So it depends.
Well, let's begin with the second question, which is, elaborate on what medical advance surprised you the most and which one do you consider to be the most interesting?
I think one of the most interesting medical advances is the fact that the 3D printing organs, because you use live cells and you do not need some type of harvest. That gives us unimaginable possibilities of what to create, and life expectancy would be so much bigger or greater in some future.
Yes, and also improving the life quality of, as I said, like those who need of these bionic structures, of these living systems. Anyone else would like to elaborate on their answer?
Me, I wanted to say I agree with Julieta and on that technological advance because I think it's very interesting how they create this. I mean, it was predictable, but the amount of technology that is now, I mean, it's amazing, and I really admire how the doctors and scientists create more and more things that can help to our health.
Okay, let's begin with the last question, which is, comparing past and current medical advances, which do you think were the most beneficial to humankind and why?
I think that the when talking about past medical advances, I think that I don't know, the creation of, which was the first one, penicillin, was just a breakthrough on how medicine will be constructed, and so I think that was a first step to many types of cures, treatments, and many more things.
Yes, I do agree with all of your opinions. Thank you very much for cooperating with the 5 minute discussion. Thank you, Paola. Thank you, Vianey. Thank you, Julieta. And thank you, Carolina. That will be the ending of this presentation. Thank you very much for your attention.